This video is made on demand by our subscriber. So this video is about local lymph node assay. Local lymph node assay is used for determining skin sensitivity or skin sensitization. Skin sensitization is a key point for safety assessment, especially for chemicals in cosmetic and personal care products. Skin sensitization is an immune reaction to exogenous reactive heptans or proheptans which react with skin proteins and render them immunogenic. The whole process can be broadly divided into sensitization and elicitation phase. In the sensitization phase, the chemical agent react with skin proteins, and dendritic cell processes the modified proteins and present the antigen to naive T cells in the local lymph nodes, leading to expansion of antigen specific T cell clones. On subsequent exposure to the same sensitizer, a specific T cell mediated immune response can be elicited, which is an elicitation phase. So this test is based on the measurement of events induced during the induction phase of skin sensitization. That is, it induces the growth of lymphocytes, specifically lymphocyte proliferation in the draining lymph nodes, which is a hallmark of skin sensitization response. So draining lymph node in the auricular lymph nodes, it is the specific site where the test chemical is applied, and then the proliferation is measured by the use of radioactive labeling or by various other means that we will discuss in the next video. So virtually all companies with occupational toxicity testing programs investigate the potential for chemicals to cause allergic reactions, but in many cases it is not done routinely, but rather under certain circumstances such as structural similarity to the known sensitizers. In the past, the protocol of choice was generally GPMT, that is guinea pig maximization test. Although the Bowler test and the mouse ear swelling test, that is MEST, were also used. Today, the method of choice is the murine local lymph node assay, that is OECD guideline 429, and has been validated in the European Union and the USA as the standalone replacement for the GPMT. The advantage of using the local lymph node assay are the reduced number of animals required, that is reduction, the avoidance of trauma, that is refinement, and the objective endpoint that permits estimation of skin sensitization potency. Still, a skin sensitization assay that allows for the total replacement of animals has not yet been developed. Local lymph node assay is incorporated worldwide into regulatory guidelines, that is OECD 429, that is, it is named as skin sensitization local lymph node assay. In these guidelines, dose and vehicle selection is very important, or which is very critical for the successful conduct and eventually interpretation of data. So overall, dose and vehicle selection means minimum 4 animals per dose groups are required and minimum 3 concentration of test substances plus positive and negative control. For example, negative control treated with vehicle only and positive control as appropriate. And the duration of the treatment is 6 days, and thereafter the animals are killed, right? So it is the alternative approach to traditional guinea pig methods, as it also provides animal welfare benefits. There is no absolute conformity in the sensitivity or sensitization potential of a substance in mouse, guinea pig, and human. Test number 442A, that is skin sensitization local lymph node assay DA, is a non-radioactive modification to the local lymph node assay method that is based on the measurement of ATP content by bioluminescence, which is an indicator of proliferation. But the experimental duration is of 8 days in this case, and the time from animal which varies from the traditional local lymph node assay, which is as per the OECD guideline 429. Once the duration is completed, thereafter the animals are killed and cell suspension of lymph node cells is prepared. The incorporation of 3-hydroxymethylthymidine is measured by the scintillation counting as disintegration per minute, that is DPM. And then the time from, in this case the required or necessary point is the time from animal sacrifice to measurement of ATP should not exceed 30 minutes, right? So then results are expressed as a stimulation index, that is SI, which is obtained by calculation, and those chemicals that prove or provide a defined level of lymph node cell proliferation which is threefold or greater increase compared to concurrent vehicle control are classified as skin sensitizers. If we talk about specific methodology, so the test material is applied to the ears of the mice, and so in the standard protocol, mice which is of CBA strain receive 3 consecutive daily application of 25 ml test substance dissolved in appropriate solvent, that is acetone olive oil or DMSO or DMF, on the dorsal surface of both ears, which is approximately 1 centimeter square each area. The test chemical will be applied, and 5 days after the first topical application, 20 mci of 3-hydroxythymidine is injected intravenously, and then 5 hours later the auricular lymph nodes are excised and processed for scintillation counting. Optionally, a tracer substance such as the 3-hydroxymethylthymidine or bromodeoxyuridine is injected intraperitoneally for lymphocyte incorporation. The animals are then euthanized and their lymph nodes are removed and analyzed. The ratio of tracer incorporation in the lymph nodes from dosed animals in compared to the control animals, which gives the stimulation index, that is SI. So in the interpretation section, when stimulation index exceeds 3, that is SI is greater than 3, a relevant sensitizing potential is assumed, which is in contrast to the classical guinea pig test, that is local lymph node assay provides a quantitative measurement of sensitizing potency of a chemical, and therefore relative potency of skin sensitizing chemicals is measured by derivation of an EC3 value, this being the concentration of chemical required to provoke a threefold increase in the proliferation of lymph node cells, that is LNC, compared with controls. The procedure from excision of lymph nodes to ATP measurement should be kept uniform for each animal and completed within 20 minutes. The luciferin or luciferase method is applied to measure the bioluminescence in RLU, that is relative luminescence units. So limitations of local lymph node assays are: local lymph node assay may not be appropriate for certain metallic compounds, surfactants, and high molecular weight proteins, strong dermal irritants, and materials that do not sufficiently adhere to the ear for an acceptable period of time during treatment. Still, due to legislation, the development of new in vitro models for skin sensitization has gained high priority. Several approaches have been implemented in order to fully replace the local lymph node assay. A wide range of models has been emerged from computer based or cell based models in many different cell types such as keratinocyte, dendritic cells and T cells. However, so far there is no validated in vitro model available for sensitization determination. Development or the why this local lymph node assay was required. So local lymph node assay was developed originally as a method for the identification of chemicals that have the potential to cause skin sensitization and allergic contact dermatitis. Also, this method is very robust method and is very useful in assessing the skin sensitization potency of test chemicals. Skin sensitization means proliferation or skin sensitization is measured or in the proliferation ratio, which is proportional to the dose applied, and it provides a measurement of skin sensitization. So it is the primary method to make comparisons of relative potency of chemicals is to use linear interpolation to estimate concentration of chemicals required to induce a stimulation index of 3 relative to concurrent vehicle treated controls. So specifically the estimation of EC3 value. In certain situations where there are available less than optimal dose response data, a log linear extrapolation method can be used to estimate an EC3 value, which can reduce significantly the need for repeat testing of chemicals. So this is overall, this local lymph node assay is a in vivo test which is used or which uses murine model. Murine is a rodent subfamily Murini, which includes more than 500 species of mice and rats. And in this test of local lymph node assay, specifically mouse of CBS strain is used, and it was developed to evaluate the skin sensitization potential of chemicals. So there is some little bit different history also included. If you want to know more about that, please tell me.